My name's Kate Rainwater. I grew up sort of a theater kid, so very active in community theaters and things like that at school. A very creative person, and in my adult life, continued to do theater and lived kind of all over the country in Chicago and Los Angeles. Met my husband doing theater, also did some professional baking, and so that's one of my other hobbies. We both really enjoy being on stage together and being in the kitchen together. And then recently, not even a year ago, moved to Omaha. Looking back now, I'm realizing there were symptoms that I didn't ignore, but that I guess I didn't realize were symptoms. So, since probably about 6 years ago or so, every once in a while, I would spot during or after sex. And I always just attributed it to having an unreliable cycle. I never really knew. It was always kind of strange. Sometimes it was 3 weeks, sometimes it was 5 weeks, sometimes there was random spotting in between. And it never hurt. So I didn't think it was cause for concern. Looking back now, I know it probably was, but the first real symptoms I had that I paid attention to were pains in my abdomen, and they were really sort of like right under my rib cage. So initially, my first trip to the doctor was to be assessed for gallbladder because that's what we thought it was. I was having pains, and I was also new to the area. We had just moved here like less than 6 months earlier. I hadn't established a primary care physician yet, so I thought, well, let's just kill two birds with one stone, do that, tell them about the pains I'm having. And with the symptoms that I gave him, he immediately was like, oh, that's definitely gallbladder. My boss, who has a background in emergency medicine, was also like, yeah, absolutely gallbladder, 100%. So they referred me to a surgeon, just a general surgeon. And he was the first person that, after meeting with him and giving him the rundown of all of my symptoms, said, I mean, it could be gallbladder, but there's also a couple of things in there that don't sound like gallbladder, and I'd like to figure out what those might be. So he had scheduled a CT, but we had to wait for it to be approved by insurance. So I wasn't going to be able to get that done for about 2.5 weeks on the 19th of March, or I'm sorry, the 19th of February. And by, I think it was like February 13th or 14th, I was in the emergency room with severe pain, doubling over. Just, it was awful. So they ended up doing the CT then rather than waiting for insurance to approve it. And they didn't see anything in my gallbladder on the CT, but in the bottom corner, they saw a shadow and thought, well, that's strange. That doesn't, maybe it's just on the machine. Maybe we need to get it looked at, but let's do an ultrasound in that area and see what that could be. And so then they ordered the ultrasound same day. I just kind of waited around for, like an hour or so. They did the ultrasound, and the ultrasound tech was, jovial and kind and all that. And then she got very, very quiet, and she was still smiling, but I work in healthcare, so I knew what that face was. And she stopped talking. And then afterwards said, I'm just going to go give your results to somebody real quick. I'll be right back. And within 2 minutes, there was the doctor on call, not a resident or a PA. The doctor on call was in my room telling me that there was a mass. And, obviously saying not to worry, it could be a million things. But of course, everybody's brain goes immediately to cancer. And about 10 minutes after that, there was a gynecologist in my room, and she was saying the same thing, but she wanted to urge me to make an appointment with her in her office or someone's office within the next like 48 hours so that they could assess what they were seeing, possibly do a biopsy and get the ball rolling there so they could make sure they knew exactly what it was. she had had a chance to look at the ultrasound and all of the images and everything. And I'm a person who, whether it's good or bad, the more information I have about something, the easier I can wrap my head around it. So I just told her up front, like, please don't sugarcoat too much. I just need information. And I asked her point blank, with the experience that you have and looking at my pictures, do you think that this is, and she didn't even let me get the word out. She said, I do. Yes. And I'm so sorry. After my meeting with her, she did an exam and she did take a couple biopsies in that office, like during that visit of my cervix. And we thought, just based on the fact that I had tested positive for HPV right before moving to Omaha, but I did the treatment that they give you, and they're like, this takes care of it in almost all cases. Like most cases, you'll be fine. So that was also another reason that I wanted to set up um, like a primary care physician, was to just sort of follow up on that. And this all happened before that could happen. So yeah. So she did an exam, did a couple biopsies, but then also set me up for a biopsy of the the mass. I had two masses. There was one that was outside of the cervix, just appeared to sort of be floating in my abdomen. It was very large. It was pushing my uterus all the way off to the side. Um, they couldn't really tell if it was connected to anything. It was completely covering my left ovary. So they couldn't see my ovary. They couldn't get to my ovary. So they did a biopsy of that mass, that tumor. And then I also had a retroperitoneal tumor that was further back, and it was in amongst my lymph nodes, and it was actually touching the iliac veins that basically control the operation of your left leg and the lower left side of your body. It was pushing on those veins as well. So both tumors were large enough that they needed to do those biopsies to see what they were dealing with. If they were benign, obviously they could have gone in, snipped them in a couple of pieces, and taken them out. But because they were both malignant, then that's where the decision of how to treat safely and make sure that we weren't hurting the surrounding structures and causing more damage. So that's kind of when that discussion started. But initially, because the biopsies of the tumors came back malignant, they just assumed, well, it must be cervical cancer because you have HPV. So it must have just metastasized outside of the cervix. It wasn't until they did further testing of the biopsies, and then they got the biopsies back from my cervix, that it turns out they were benign. So then they did some biopsies of my uterus, and they were benign. So at that point, I had already started chemotherapy. We decided not to do radiation because of the location of the tumors, especially the retroperitoneal. There wasn't going to be a way to safely point the radiation at the tumors without the real possibility of damaging the surrounding structures. And maybe I wouldn't be able to, there was a possibility that I would lose the use of my left leg in the process, if they damaged those iliacs. It could have damaged like the bladder and kidney and other things that are just right there that the tumors were literally pushing out of the way. So we did chemotherapy first. But then at that point, I think it was my like second round of chemo that I had just completed, and they changed my diagnosis from cervical to presumed ovarian. But because the tumor up front was completely covering and encompassing my ovary, they couldn't take a biopsy of it. They couldn't get to it. So we were just presuming that was it. Initially, she didn't think it would be ovarian because it was a squamous cell carcinoma. And squamous tumors account for less than 1% of all ovarian cancers. There's so few documented cases, like less than 50 worldwide, I believe. So the chances of it being that were so rare that just her mind didn't even go there until all of the biopsies that she had done came back benign. So that was scary too, to just think like, okay, so not only do you have cancer, but you have this super, super rare cancer that she has only treated one time in her career. And so she started reaching out to the Mayo Clinic and to a clinic in New York that specializes in rare gynecological cancers. She was talking to tumor boards all over the country. I mean, she just went really above and beyond to try to figure out the best way to treat me and to make sure that I would come out of it not just alive, but, healthy. The plan for treatment, because we couldn't safely do radiation, was to do chemotherapy and to see how the tumors reacted to the chemo. And hopefully they would shrink enough that the surgeons could then go in and remove them safely. So that was really the big thing, was at the time of diagnosis, the tumors were so big, it was not going to be safe for me at all for them to go in and try to remove them. They were just taking up too much space, and there were too many other things that they were touching, pushing out of the way. So it was just too dangerous. So we did the first round of chemo. And then a week later, I had a rash show up. And I ended up in the emergency room that night. They didn't really know what was going on, so they gave me some steroids and some anti-itch stuff, I guess, and some fluids, and sent me home. And it was a smaller hospital, not the hospital that I get my treatment at now, but it was just a smaller hospital that they can work with in conjunction that's only a couple of blocks from my house. So by the next afternoon, I was on the phone with my oncologist because I was covered head to toe and my rash was purple. Um, it was it was really, really bad. And so I sent a photo to my oncologist's nurse, and she told me to go to the emergency room at the main Methodist hospital in downtown Omaha immediately. And so I got there. They worked really, really quickly, and they admitted me. And doctor after doctor and nurse after nurse kept coming in and saying, like, wow, this is so cool. This is the worst chemo rash we've ever seen, which for myself and my husband was not comforting in the least. But within 24 hours, you could tell that it was starting to go away just a little bit. I still looked terrible. It was still very, very present. It took a full 5 days in the hospital for it to go away enough that they felt safe to send me home. But I'd say it stuck around a little bit for about a week and a half. And I was still on steroids after that for a couple of weeks following until my next chemo treatment. So then when I went in for my second chemo treatment, they really had no choice because they didn't know what chemo drug caused it. So they had no choice but to discontinue the Keytruda immunotherapy that I had qualified for. Um, and they gave me the same chemo drugs that they had given me the first time. They just did it one by one, very slowly, to see what I would react to. And that was really scary. But it was the only way that they could figure out how to continue to treat me safely because the only other option was to discontinue treatment. And that was not an option that I was willing to accept. So they gave me the drug that's called paclitaxel, or Taxol for short. And I didn't even get like 3, 4 minutes in before I noticed a bump on my arm and then a bump on my other arm. And I called the nurse in and they stopped it immediately. They gave me tons of steroids and Benadryl. And then they ended up having to do a super, super low dose that if they had continued at that dose, it would have taken 9 hours just to administer that one chemo drug. But they were able to titrate the dose up. So every half hour, they would increase the drip by a little bit more and a little bit more and a little bit more. But I was in the cancer center that day for, I think, about 9.5 hours when all was said and done. So after that, I was still on steroids. And so then the concern became the other organs, kidney and liver. If you're on steroids too much, it can sort of wreak havoc on its own, totally apart from everything that the cancer is doing. So the goal then became like, how do we treat this cancer? How do we get you off of these steroids? My glucose numbers were through the roof. So I had to meet with an endocrinologist and start on insulin because of all the steroids. So we just added that to the list of problems that were, coming up because of the cancer. And then through doing that, we learned that I actually have type 1 diabetes and that I had been undiagnosed for however long. So now I have cancer that they think might be ovarian. They are having trouble treating me with chemo. Now I'm on insulin and I have a lifelong diagnosis of type 1 diabetes that about a week later they found also comes with Hashimoto's autoimmune disorder. So it really started to pile on. And it was hard. Like it was really, really difficult to believe that there was still a light at the end of the tunnel. It felt like God was really testing me and was like, okay, so we're just going to keep going and we're going to see how strong you are and if you can get through this. And so thank God for my husband who just sat by my side and cooked for me and took care of me. I literally had a little bell next to my bed that I could ring, and he'd come running and ask what I needed. And sometimes it was just a hug, other times it was a sandwich or a snack, whatever. But having that support system, I think, I honestly don't think I could have gotten through all of that without him. So after the third, we did an MRI to see, what size, like how the tumors were looking and how all of my organs and everything inside were looking. And my tumors had shrunk by 50%, which I think was somewhat of a surprise, like obviously a very happy surprise for my oncologist and the nurses and everybody that had been involved at that point. So we actually decided because the tumors are responding so well to the chemo, they're 50%, in size, but they're still pretty big and they're still touching a lot of stuff in there. So let's do a few more rounds of chemo now that we've kind of figured out how to do it safely and see if we can get them to shrink a bit more. So we did 2 more rounds of chemo and then did another scan, and they had shrunk by another 25%. So at that point, my oncologist spoke with a couple of other surgeons just because of the location of the tumors. She had to make sure that there was a general surgeon on board and a vascular surgeon as well because of those iliac veins, just in case, she needed somebody to step in if they were fused together, which can happen sometimes that with chemo, the tumors can fuse to organs and other things that are in the area. And so she had all of that lined up and all ready to go. So I had surgery 3 weeks ago today. I went in for the surgery, and the my oncologist had told my husband and family that they should plan for about 6 hours. And she was going to use the robot. She was going to try to do everything laparoscopically with 5 incisions, just sort of spread out in sort of a rainbow across my abdomen. And she got in there and got the tumors, did a full hysterectomy, including fallopian tubes and ovaries, cervix, uterus, everything. She wasn't real sure exactly what she was going to find as far as the other organs were concerned, beyond just what she was taking for the hysterectomy. So luckily, they all looked good, and my blood tests were good on them. So she didn't have to take anything extra. I met with my oncologist and, we went over the pathology report. She told me that everything that she removed is looked pink and healthy, and the pathologist said everything looks completely normal. They tested everything and it all came back benign. The tumors themselves, the plan was to send them off for genetic testing so that we could figure out once and for all where the cancer came from, if it was in fact ovarian or something else that they haven't even considered. Unfortunately, they're not able to do that. But the good news is they're not able to do it because the tumors were necrotic. They weren't even live tissue at this point. They were just dead, just completely fried. So the good news is that from basically that all results in me being cancer free as of yesterday. I can't even say it without tearing up. I'm just obviously, it's been the most wild ride ever. Cancer is enough, but dealing with everything else I've had to deal with, it just felt like we weren't going to get here. So, yeah, we had talked about like, okay, so the cancer is gone. Do we need to do the 2 rounds of chemo that we had planned on? And ultimately, we decided yes, we are still going to do them because there's always that chance that there is some like super microscopic little cells in there that they're not able to biopsy, that they're not able to test, that are still just sort of floating around, where all of that stuff that she took out used to be. What we're not doing though is the Abraxane. So we are basically paring down the chemotherapy. I really want to be able to continue the immunotherapy even after chemo. So what we've decided to do is the cisplatin, which was sort of the workhorse chemo and one that I did not seem to have any reaction to at all, other than your typical, like, being lethargic after chemo treatments and maybe a headache or two here and there. But it didn't really seem to affect me any more than what they would expect. And then we'll also do the Keytruda immunotherapy. So I start that again a week from yesterday, so on Monday. And then 3 weeks after that, I will do my final chemotherapy treatment. And that again will just be the cisplatin and the immunotherapy. And I'll get to ring the bell, which I'm very excited for. And then moving forward after that, as long as my body doesn't have a reaction to the Keytruda, these next 2 rounds of chemo, then that's something that I can continue so that my immune system is getting a boost every 6 weeks. And it's, to my understanding, it's purely preventative, something that I can do for the next 2 years, every 6 weeks, to really just ensure that the cancer doesn't come back. You have to allow yourself to feel the feelings. I think I'm kind of lucky that we're living in an age where mental health is finally coming to the forefront and people are paying attention to it. So those resources are there like they haven't been ever before in my lifetime. Um, the cancer center where I get treatment actually lined me up with a therapist. And they're a part of the cancer center team. So they're used to talking to people all day, every day, who have all different kinds of cancer or who are caring for someone who has cancer. And the coping mechanisms and skills that they're able to outline, and they don't feel cookie cutter. It really feels like it's based on who I am. I'm not a type A personality, I wouldn't say, but I definitely like to have control over situations. I'm a planner for sure. I love me a to-do list. Um, Attention to detail is definitely one of my strong suits. So when something like this happens and you have no control over it and nothing you did could have stopped it from happening, and all you can really do is start to just eat healthy and, hope that you're surrounded by good people. Just, yeah. I mean, the best piece of advice I can give is just to let yourself feel the feelings because you need to. Like, it's a big deal. Cancer is a big deal. So, surrounding yourself with people who get that, who don't try to, oh, buck up, buttercup, like that has its time and its place. But in this situation, there are days where I wake up and I'm like, today is going to be a really crappy day emotionally. And that's okay. As long as I let myself have that day and understand that tomorrow is a new day. And tomorrow doesn't have to be that way. I just married my husband 3 years ago. And It's a second marriage for both of us. And I don't know how to explain that it feels so different than any relationship I've ever been in before. And I know he would say the exact same thing. And we've been together for 9 years. That's just not enough, and we have two girls. They just started college. They're both going into their third year of college. And I want to see them grow, and I want to see what happens in their careers and, maybe hold a grandbaby or two. So I'm not even 40 yet. I'm not done. So the thought of, I mean, it was so hard to get through, but giving up never crossed my mind. Not an option. Life is just worth it. The advice would be listen to your body. I can't help but wonder if I had seen that spotting, during intercourse years ago as a sign of something, or if those couple of periods that I had that were the cramping was so severe, if I hadn't just written that off as, well, this must just be a really rough month, would they have caught it sooner? Would it have been so bad? So I think as women, we are so often taught to just, you grin and bear it. And we are incredible. We are so strong, but it's also okay to not be. And it's okay to admit that something might be wrong. So go to your doctor, get the tests done. And if you are like me and you're of the age where you were too old to get the HPV vaccine when it came out, they don't typically test for that during your annual screening. And I didn't know that. I had no idea. The only reason they test for that most of the time is if your results from your pap smear come back abnormal. And by then it's too late. So ask every year to have that done. And even though they tell you you can, maybe go once every 3 years now, don't do that. You're worth so much more. Go every year. It's uncomfortable, but it's a half hour of being uncomfortable that could save your life.